Ultra-low-frequency electric currents reduced perceived lower back pain by 90% in a group of 18 patients. Scientists report August 25 in Science Translational Medicine. The changes in pain scores are impressive, says Jeremy Walker, an anesthesiologist at Vanderbilt University Medical Center who was not involved in the study. While I would have some concerns about the long-term effects. The degree of pain relief certainly justifies further study. Most treatments for pain are pharmaceutical, but unfortunately these drugs can come with serious side effects, including the risk of developing a substance use disorder. Deep brain stimulation, where an electrode is inserted far in the brain so it can deliver pulses that tell certain neurons to fire and release neurotransmitters, has been used for decades to treat Parkinson's disease, for example. Some groups have even tried a similar technique to stimulate nerves in the spinal cord to manage pain, but results have been mixed. McMahon, the senior author of the new study, says that's because controlling pain requires a different stimulation strategy than treating diseases such as Parkinson's. Direct currents, which flow continuously in a single direction for much longer than the millisecond-long pulses of the neurons themselves, can switch them off, but such relentless stimulation can cause tissue damage if repeated long-term. The team started the study in rats. As hypothesized, delivering slow pulses to the spinal nerves of the animals successfully blocked neuronal signals associated with pain. Then, they programmed the devices to deliver ultra-low-frequency pulses of electricity throughout the day. Over the course of the 2-week treatment period, each patient checked in with the researchers every few days to report their pain level and for adjustments to the stimulation program as needed. 2 patients dropped out due to infections at the implantation site. The participants that completed the trial received between 249.5 and 336.4 hours of electrical stimulation over the 15 days. Within hours, many of the patients started reporting improvements in pain scores. After 15 days, they reported feeling 90% less back pain on average and said it was easier to walk and otherwise move around. This is an advance over other electrical stimulation approaches, as it avoids using direct current which can lead to neuronal damage, says Laura Bohn, a molecular biologist and neuroscientist at the Scripps Research Institute who was not involved in the study. As of yet, there isn't any data on the effects of continued ultra-low-frequency electrical stimulation. Statistically, I think it is a very amazing finding, says McMahon, but he admits the study's size and lack of randomization are limitations. We definitely need to make sure that the findings hold in the real world, in large populations, over long periods of time. Still, he says the most exciting part is that the effects are just black and white. It is pretty amazing that you have this level of control. Quote. Please support my channel to grow by pressing subscribe button and the bell icon. We will notify you technological news. Thank you.